India's coronavirus count is now over 50,000. While the last few days have seen a record rise in daily infections, we've also seen a rapid rise in testing. Now, let's take a look at the trajectory so far this month. Daily cases have been around 3,000 on an average, but daily tests have also gone up from around 60,000 to about 85,000 over the last couple of days. Even as daily infections rise, the deaths have remained largely steady and recoveries have also risen. Now, since the start of this month, daily deaths have been around 90 to 140. Daily recoveries have also steadily been above 1,000 for the last 3 days, even touching 1,300 on the 5th of May. Joining me now to make sense of the data is Dr. Sanjay Oak, the head of the Medical Task Force in Maharashtra. I also have with me Dr. Jayaprakash Mulyal, the chairman of the Scientific Committee of the National Institute of Epidemiology, formerly also the principal of the Christian Medical College in Vellore. Dr. Oak and Dr. Mulyal, many thanks for joining us on the program. Dr. Mulyal, let me start by asking you, sir, what do you make of the data currently in the context of the fact that we've only seen the restrictions being eased from the 4th of May? Do you believe that the rise that we're seeing is worrying? Does it concern you? Or do you link this then to the fact that we're testing more today?
Well, the rise is anticipated because that's why we call it an epidemic. But there is also a problem here because the definition of what is a case is slightly changing. Now, earlier, the cases used to be those who come with cough and breathlessness when tested, and if they are shown to be positive, we called it a case. That was the bulk of it, or some contact or travel. Now, there is an active search for coronavirus carriers. They are mostly subclinical infection, but their carriers are fraud. So when you add them into the pool, what it looks like for an observer is a tremendous increase in cases. On the whole, this indicates there is a wider spread of infection in certain parts of the country, wherever you see this rise. And that is what the whole story of this virus infection is. We can't say we are surprised. No, it is the way this particular epidemic is supposed to proceed. If it didn't go up, then we would be very surprised. But please also remember, there's a little contamination in our thinking because what we called a case, the definition has been changed. So there is an increase due to that phenomenon also.
Okay. So you're essentially saying that this is along anticipated lines, that this is what you were expecting to happen in any case, and also the fact that the definition has changed, that is also leading to this increase that we are seeing in the number of cases. But what do you make, sir, of the current recovery rate, which is being pegged at about 28.8%? Do you believe that that should give us reason? I mean, that's the silver lining in all of this. And also the mortality rate, because even as far as the mortality rate calculation itself is concerned, one view is that we can compare deaths with the total cases only after the pandemic is actually over. Doing it currently, is that a bit premature? What do you make of the way that the mortality rate is being calculated as well?
Well, there is a problem for us in terms of knowing what is called as a disease-specific mortality rate, which is deaths due to coronavirus. By definition, all the people who got either infected or became cases, how many died. But we can only diagnose a death due to coronavirus when the test has been done and shown the person has had coronavirus. The best estimate of the impact of this epidemic will lie in the measurement of total mortality during the period of epidemic. And that would be the final answer to the question. And you pointed out, as you pointed out, it will be the total mortality which will show the better understanding or impact of this epidemic.
So, Dr. Mulyal, where does this leave us then from a point of view of action. Now, what we've seen is through this 40-day lockdown period, and now we're in the midst of lockdown 3, the cases have continued to rise. And this is what you were cautioning about as well, that you cannot lock down the virus necessarily. You can only contain it. Now, in terms of policy response, given where we find ourselves today, what do you believe needs to be the road ahead?
I think we have very, very clear directions chalked out in front of us. We have to follow that. Number one, the warriors are no more the police or the controlling forces. It is going to be hospitals, doctors, nurses, and the staff. First is to strengthen their ability to fight the war, protect them, give them adequate gear, oxygen supply, etc. That is number one. Improve the facilities for patients to reach the hospital so that they can be saved wherever possible. Remember, many people who become breathless because of coronavirus can easily be saved if they reach a hospital which gives adequate care. Having said this, my whole team start making sure the elderly are not infected, because they innately lack the ability to fight the disease back, and there will be high mortality. If India has to come away at the end of the story having much less mortality, it will be in our ability to make sure the elderly or those who are above 55 don't get infected.
So to put it simply, Dr. Mulyal, and this has been your pitch from day one, that keep the elderly away, but let the rest of the economy get down to action. Your idea about herd immunity, now where we currently stand as far as the cases are concerned, as well as the way that the curve is moving, do you believe we're any closer to herd immunity?
Well, the data that we are getting at the moment is sketchy. Now, please remember, there is the test for looking at community level infection, or rather, what proportion have already been infected and gained immunity, is completely lacking. We tried with a very poor test, and we came out losers. So, fortunately, from within India and some companies from outside have produced excellent tests for do so. But regardless of the test, that is the important thing to remember, is that this expansion or explosion, or what you call an exponential increase, is something that we have to think and manage efficiently. Now, you may try again lockdown, but I don't know whether that's going to help, because what you need is a quick accessibility to hospital by patient, and the problem will be that city hospital will be very, very crowded with these patients. And that is a short phase. And when you see that, then you know probably that we are in the end game. We are still not being exposed to that kind of a large number of influx of patients, but we should consciously anticipate it. Our success in dealing with this problem will be in accurately anticipating how much a load we are going to face.
Dr. Oak, many thanks for joining us on CNBC TV18. Let me start by asking you about what you make of the rise of cases. Would you say that this is alarming, that this is a matter for concern and worry, or do you believe that as the testing has started to pick up pace, we're also seeing a continuation as far as the rise in the number of cases concerned?
I would attribute it to both the things. That if you all agree, the pandemic has always followed a parabolic pattern. When there is a crescendo, the cases go on increasing, then it will reach a level, plateau, and then it will descend.
Okay.
So I feel we are very close to that particular plateau.
Okay.
And the fact is also true that in Mumbai we are doing tests at an alarming numbers.
Okay.
So the more you test, the more you are likely to get positive cases. So both things have resulted into cases coming up.
Okay, so when you say that we're very close to a plateau, sir, if you could, for the benefit of our viewers, explain what you mean by that.
See, I mean, if you look at multiple countries where this pandemic has already spread, the cases have gradually increased, then there is a steep increase. Then the average number of cases that you pick up or the mortality that gets kind of a stationary level, and then gradually it starts descending. That is what I mean. So I think we are still on the rise. And we are on the rise because also we are testing many cases. That's what it is.
Just to give some indication of the testing process itself, sir, and you're right in the fact that Mumbai specifically and of course Maharashtra has been ahead of the curve when it comes to testing. How much are we testing on a daily basis? Do you believe that at this point in time you would take heart from at least the recovery rate, which has also been rising?
Yes, I mean, to tell you precisely, it is the number of recovery, as you rightly mentioned, the people who are going home, people who are turning asymptomatic, people who are not progressing to a more morbid condition, that is definitely rising. In the terms of epidemiology, the doubling time, that is increasing, which is a good sign. That means the number of days that one requires to make the number of cases double. So more the number, better it is, and that's what is now happening. So the cases are being tested, the contacts are being tested, close-knit families who stay very close in say about a 10 by 10 feet home, they are tested. So this all has resulted into a significant number of tests being done.
Okay, so when you talk about the increase in testing as well as the increase in the recovery rate, I also want to understand how we are likely to cope with the rise in the number of cases. The BMC has said that it is working to ensure that there is health infrastructure to deal with 75,000 cases if needed by the end of May. Now, at this point in time, in Mumbai, for instance, what is the number of people requiring critical care, requiring ventilator support? Do you believe that as the number of cases rises, is the infrastructure in place to cope with it?
Yeah, I mean, the infrastructure at no place has been adequate in all across the world. So in Mumbai, the infrastructure is being very rapidly augmented. And what we are doing is we are setting up mega hospitals in the open fields. For example, the BKC grounds is going ahead with a 1,000 bedded facility. A similar facility is also being constructed at Jogeshwari Exhibition Center. The domes at Varadi are already having 500 bedded unit, and which is being excellently conducted. People have been admitted, people have been cared, and people have now been discharged out of it. There is one actually seal, and that is with the number of ICU beds. Because if the people fall more sick and become more morbid, then they need an ICU. And the number of ICU beds put together in the public and in the private sector, that may not be adequate as it appears just now. And that is why we are working very hard, promoting private sector also to put up more ICU beds, increasing the number of ICU facilities in the public sector. And from this perspective, when appeal has been done to Railway Hospital, to Naval Hospital, that they could also extend their ICU services. So I think that is very important now.
What is the shortfall that you believe we are faced with when it comes to ICU beds, at least in Mumbai at this point in time? The expected shortfall?
No, I mean, it is very difficult, Shireen, to predict the numbers. The 75,000 has been a prediction which has been done by the central team. However, we feel that let us at least be prepared for at least half of it, and that is what our efforts are.
Okay, at least for half of it. Now, sir, I also want to understand what
At least
constraints.
half, because see,
Yeah.
whatever were the predictions, whatever were the predictions for 30th of April, the Mumbai numbers are definitely lesser than that.
Yes.
However, the numbers are worrisome, and that is what I said, that let's get prepared for more number of patients and ICU beds.
Absolutely. But I also want to understand from you what the situation on the ground is when it comes to PPEs, etc., because that was also a constraint. Now, as you see the cases rising, whether there is adequate support on the side of PPEs, masks, etc., and also healthcare professionals and healthcare workers, because there has been an order that's been put out to try and enlist the support of the private sector healthcare workers compulsorily in the city. So what is the problem that you're facing there?
No, I think we are addressing the situation in a multi-pronged manner. That's how I would put it as. When the pandemic started in country, there was paucity of N95 masks. There was difficulty in getting PPE, and the PPEs were pretty expensive. But what has happened with the progress of time is that several Indian small-scale people, even the Mahila Bachat Ghats, as you know, they have started making them. So just now the availability of the PPE is not a major issue.
Okay.
Well, the distribution at time poses difficulties to reach it to the eventually finally every person who must wear it, because PPE is the best and the only protection from protecting a healthcare worker from contracting the virus. So therefore now it is the optimization of PPE, optimization of the cost of that PPE at which it is being purchased, and distribution. All these things are being looked into, and I think there is a reason to be, smile. That's one point.
Okay.
Second point, you asked me about healthcare workers. Now,
Yes.
yeah, that's a very, very critical point. And therefore, we have made an appeal. We are also taking together our Ayush colleagues from Ayurveda, from homeopathy, who can come with us to support the activities. We have called our residents. In fact, the MART, the Resident Doctors Association, is well within the forefront in managing this. We have also taken the help of our interns, those people who had superannuated a couple of years ago or things like that. They have been called back. Though they are above 55, they cannot be put into forefront, but they can do a lot of supportive and advisory kind of work. So they are there. So on all these fronts, I think the manpower enrichment is in progress.
Okay. Sir, if you can just help us understand where the fresh cases are coming from. Dharavi, of course, has been a point of concern. Purely because of the lack of social distancing, etc., which is not really possible there. So where is this rise of cases coming from, at least as far as Mumbai is concerned? What's the current occupancy, both in private sector hospitals as well as the hospitals that are being used by the government, Kasturba, etc.? What is the current occupancy rate?
No, Shirin, you would smile at this, but the occupancy rate all across public as well as private is over 100% and even more than that.
Okay.
To find a bed for the general ward, to find a bed for ICU is an onerous task now.
Okay.
Several hospitals, and initially we started classifying a hospital as COVID and non-COVID, but that really cannot hold true. And now, in fact, is the situation that almost all hospitals have become hybrid hospitals.
Okay.
Apart from the fact that there are some hospitals who are dedicatedly taking the COVID work. And it's not only COVID, it is COVID pregnant mother, COVID pregnant woman delivering, COVID small babies, newborn babies being born. So all those things are really happening. And that is why the effort of augmenting the beds at new hospitals. That's what is happening.
Okay, so you're saying occupancy is 100%. In fact, hard to find beds at this point in time. What is working, Dr. Oak, in terms of the treatment protocol? The use of HCQ, Favipar. What exactly is working on the ground? What is your own experience telling you?
No, it's the medical fraternity is rather divided on the HCQ's role, either as a prophylaxis or as a treatment protocol. In that, there are divided opinions. So we have really concentrated on early identification. And therefore, we are doing a massive campaign in the unorganized dwellings of Mumbai, where we are doing a campaign with pulse oximetry.
Okay.
And by this, we pick up individuals who are more than 55, 60 years of age, who have diabetes uncontrolled, who have hypertension, who are obese. Now these are the real danger cases. It's not the COVID that kills, it's the complications that accompany the COVID because of these comorbidities, they kill. So the best way is to pick up people even before they land up into difficulties, and that's what is being done by this particular mass campaigns of pulse oximetry.
Okay.
By now, I may tell you that having scanned about 10 lakh population, 10 lakh plus population, 778 people were identified who fitted in those categories.
Okay.
And they were taken into CCCs, they were taken into the hospitals, given the necessary treatment. I think this is a very important step. Plus, we have identified that it is not an intubated ventilator, but it is what is called as high flow nasal cannula oxygen.
Okay.
That is what is salvaging people. So we are utilizing that technique. There are several people who have said that prone nursing is better than supine position patient sleeping. So even that has been put into practice. And then there are newer drugs which have been identified and put to use. As you know, even plasma therapy has been cleared
Yes.
by ICMR on an experimental basis.
Yes.
So as and when it satisfies the inclusion criteria of the protocol, even that will be tried.
Okay. I also want to understand, sir, is the bulk of the cases that you're seeing, at least in Mumbai, of asymptomatic patients? Because that is something that we're seeing being reported from large parts of the world as well. What is the experience? Are you still seeing a
Yes.
large chunk of asymptomatic patients coming in?
Yes, indeed. And if you try and understand the nature of this virus, it is not a very dogmatic virus. It is a virus that would lead to symptoms such as cough, cold, fever, difficulty to swallow, and loss of taste of your tongue and loss of smell. Now, these are not, plus fever. Now, these are not very morbid kind of presentations.
Right.
So, many of them do not have any symptoms also. Now, who would get symptoms and who would not would entirely depend upon individual immunity and the presence of comorbid conditions and the age. So you are right, we are seeing a significant number of asymptomatic cases, but we are following them up. They are advised quarantine. If their homes are all right, they could be home quarantined. But if their homes are unorganized, then they could be quarantined in a corona care center.
Okay. So, you know, given where we are today, and as you said that at this point in time, you're trying very hard to augment healthcare infrastructure, what is the view then as far as the lockdown itself is concerned? Do you believe that a gradual lifting is warranted, at least as far as the city of Mumbai is concerned, or do you believe that the lockdown should continue?
No, I think the decision of lockdown is a multifactorial one. Health sector would just become one aspect of it. If I have to put it in simple words, I would definitely like to watch the things as they are progressing. See, today we are on 7th of May. There are still about 1 week plus time available. So if in this period we are able to improve the containment or the containing of this particular disease process, then one could think of partial relaxations.
Okay, one could think of partial relaxations if there is containment. But what about herd immunity, sir? You know, as many have said, that this is a virus that is not going away anytime soon. You can only contain it by doing these lockdowns, etc. But till the time that there is a vaccine or a medical cure that's found, we are going to have to learn to live with it and learn to cope with it. Now, as a medical practitioner who's involved on the front lines, do you believe that that now has to be part of the approach that we build in?
I entirely agree with the statement that this virus is now unlikely to go. Probably it will stay with us, settle down with us at a much lower ebb. It will become a part of our routine existence. If tomorrow somebody gets a fever and somebody gets cough, cold, sneezing, such symptoms, the consulting doctor might ask you to do a COVID test. That is the implication of the virus staying together. Now you touched upon a point of herd immunity. It's a very it's a fact that the herd immunity exists, but whether we have reached that point or not would be decided by the number of new cases that are coming up on a daily basis. And I think we are still little away from that.
Okay, you believe that we're still a little away from that. But again, sir, I want to just end by asking you, because, you know, there is so much fear with respect to the spread of the virus, with the number of cases rising. In your assessment, and you said that this is not a dogmatic virus, so to speak, in your assessment, what are you seeing in terms of the ratio of patients requiring critical care versus the number of patients who recover, you know, in a matter of a few days with the compulsory 14-day quarantine?
Definitely more number of people are recovering. See, if I put Bombay together, and if we say about 200 to 300 cases getting admitted in a hospital on a daily basis, then at least about 60 to 80 per day are being discharged also.
Okay.
And therefore, I repeat that this is not a very dominant virus, and what is required is people should help themselves. And what should they do? They should self-contain themselves in their homes. I mean, this is a statement that we have heard often, repeated in the last few weeks. But the success of defeating corona lies in that particular truth.
Self-containing, that is the advice coming in there from Dr. Oak. Dr. Mulyal, I'll give you the final say, sir. And again, for the benefit of people who are watching, you know, to help us put these numbers in perspective, because there's so much information coming at you, not just numbers in India, but what you hear about what's happening outside of India as well. To put this in perspective, what should we do at this point in time? How do we make sense of these numbers? And what should we expect over the next few days?
Is the question to me?
Yes, sir.
I think we will expect the number of infections to rise, consequently number of cases to rise, and that is the natural phenomenon. And I think there is also should be a continued effort by individuals to protect themselves. Protection really in the hands of the individual. We should never forget that. As long as they have a behavioral pattern which prevents transmission, we will still be able to slow down the rate at which the whole thing is progressing.
Now that, Dr. Mulyal, you know, some degree of economic activity is restarting. There are relaxations to resume economic activity in green zones, in orange zones, and in some cases even in red zones. What should be kept in mind as we move forward?
It is a great boon to many people who have been locked up, that they can go out and work, and there is a sense of dignity that comes into them. That is a positive aspect. However, this comes with a little bit of anxiety about increased transmission. And that's why I said this lockdown or relaxation should accompany serious continued education, saying that protect oneself and protect elders in the family. Because they cannot forget, they should not think everything is over. Today somebody told me, sir, the COVID is gone because there was a relaxation. That should not be the message that we should transmit to people. People will realize we are still in the midst of a very serious crisis. And personal protection, wearing masks when necessary, and keeping a distance are so important even today.
Personal protection is going to be the key to coping with the coronavirus. As both Dr. Mulyal as well as Dr. Oak repeatedly pointed out, it is up to us to ensure that we keep ourselves safe, and part of the system to keep the most vulnerable, which is people above 60, away from any kind of activity to try and ensure that they are kept safe. But that's the message coming in from the medical experts. Dr. Mulyal and Dr. Oak, thanks very much for joining us here on CNBC-TV18 to help us understand where we stand in our fight against coronavirus. We'll take a break. There's a lot more coming up. Don't go anywhere.
यार मेरे कजन की वजह से ना पूरे घर में फैल गया।